We're going to discuss estrogen metabolism. So we're going to be focusing on this amazing picture here. Estrogen metabolism goes through 3 steps. Phase one, mostly in the liver, some enzymes called cytochrome enzymes. They're responsible for this phase. Phase two, sulfation and methylation, also mostly in the liver. And phase three, glucuronidation. This goes in the gut by bacteria that secretes beta-glucuronidase. It's an enzyme. So what happens is that estrogen first have to be metabolized into more toxic intermediate. After phase one, estrogen becomes more toxic, carcinogenic. Unfortunately, it's a step that we have to go through to be able to metabolize it to the soluble kind that can get secreted in the urine or the stool. So unfortunately, we have to go through phase one to be able to get to phase two. Now, if you recall with me, the type of estrogens that we discussed in prior videos, we have 2-hydroxyestrone, which is protective, and we want to metabolize that to methoxyestrone in phase two. Phase one can result in 4-hydroxyestrone, but there are 2 ways to go around it, whether methylation to 4-methoxyestrone, or it can be changed into ketones, which are very carcinogenic, but if we have proper glutathione, we can neutralize this and get rid of it. Or the 16-hydroxyestrone, which is the carcinogenic, but we need to add an extra hydrogen to change it to estriol, which is protective and also neutralized. Now, here in this picture, if you recall, if we want to go through one of these pathways, we would prefer to go to 2-hydroxyestrone. And here is another explanation for methylation. We either methylation pathway that get rid of these kinds, or through sulfation reductase that we can get rid of the 16-hydroxyestrone. Again, for hydroxy, either we use methylation or glutathione to get rid of toxic intermediate. Now, we have genetic testing that can show us if we have a genetic SNP in phase one that is causing us to make more of the 16-hydroxy versus the 2-hydroxy. Also, phase two, we need to have proper methylation and appropriate glutathione to have good phase two. And there are interventions to lower our estrogen by supporting sulfation, supporting glutathione, and supporting methylation by taking supplements like glucosamine sulfate, sodium sulfate, by taking supplements or vegetables and fruits that have active folic acid, B6 and B12, methionine, betaine, SAMe. These are the factors we need to have proper methylation. Now, there is also genetic testing that can show us if we have a problem with phase two, problem with methylation like MTHFR or COMT, or problem with glutathione like glutathione transferase. Now, step 3 that goes in the gut. Basically, we have a gut bacteria that can secrete an enzyme called beta-glucuronidase. So when your estrogen become neutralized and go out in the stool, you want to make sure you have proper bowel movement to get rid of this estrogen as fast as possible. And you don't want it to stay in the gut for a long time, because if it does, bacteria will act through an enzyme called a beta-glucuronidase. This process is called glucuronidation and will break down estrogen again and circulate it back into your bloodstream. And you don't want that through the liver. So how can we neutralize the effect of beta-glucuronidase? As I said, make sure we move our bowels, taking things like magnesium. Make sure we treat any gut dysbiosis or any yeast overgrowth. These are secrete things called mycoestrogens. Alcohol from the yeast too is another added problem that can go to the liver. Avoid alcohol consumption so that you avoid the effect on the liver. Magnesium to move your bowel. Take things with high fibers, things like flaxseed. They have also omega-3. Now, an important compound called calcium D-glucuronate. Calcium D-glucuronate can be taken as a supplement. that blocks the effect of beta-glucuronidase. So when we find that you have got dysbiosis, you have high beta-glucuronidase on stool studies, we recommend taking calcium D-glucuronate. Now, I hope you found this video useful. Please follow us for more videos. Thank you.